This week, I have a few things I want to share with you. The first one is about Dr. Alicia Russell, one of our OBGYNs. Her team in the OB department wants to recognize her as a team player. She is proactive with her patients, she documents well, and she's a great team member. Thank you, Dr. Russell, for your participation and for your care for our patients and for the culture at the hospital. Dr. Russell is currently serving as the chief of the OBGYN service and for the medical staff, and serves on our medical executive committee. The next thing I want to share about is salary increases. I know that everyone works here because of our great culture and our great mission and because you care about our patients. But I know you wouldn't be able to afford to work here if it weren't that we pay you. Pay is an important part of making this a great place to work. Effective July 1, there will be increases for nearly all of our associates. If you don't get a salary increase, those of you who are topped out will get a one-time bonus. We want to make sure that we pay equitably across all of our organizations, so people will get step increases, and some people, based on market need, will get market adjustments. This applies to both salary employees and hourly employees. If you have questions, I encourage you to contact the contact center. I also want to remind you that even though the salary increase is effective July 1, you won't see it in your paycheck until July 19, because as you know, it takes 2 weeks and then a few days for that payroll to start. So you'll see your pay raise on July 19 paycheck. Next thing I want to share is our Joint Commission mock survey that we had last week. Maria Mesner from our Adventist Health corporate offices and our Adventist Health Joint Commission expert was here to help us review our processes and readiness for Joint Commission. Joint Commission is an important part of our regulatory compliance to make sure that we can continue to serve our community in the best way possible. Joint Commission provides us with what we call deemed status, which allows us to bill Medicare and Medi-Cal for services that we give to those patients. This regulatory process is so important to keep our patient safety high and to make sure that we continue to be able to serve. Thank you for doing all the things from cardboard to keeping supply rooms clean to doing all the documentation necessary and keeping up on your CEUs and your continuing education and your requirements inside the hospital to make sure that we are always compliant. I so much appreciate you being a member of this Adventist Health Lodi Memorial team, and I'm grateful to serve beside you. Thank you.